I'm blessed to be joining you today for an important conversation that may just save your life. I'm your host, Reverend Dr. Irie L. Session, co-pastor of The Gathering, a Womanist church. Joining me today are Dr. Carol Lee Estelle, MD, an infectious disease physician at UT Southwestern Medical Center and the Associate Chief of Infection Prevention at Parkland, and a member of CV Roman Medical Society, the DFW chapter of NMA, and Dr. Wendy Parnell, an OB-GYN at Carlos and Parnell, and a member of the Dallas County Medical Society and National Medical Association. We know that the last 18 months have been hard on a lot of you as we continue to fight COVID-19. There have been all kinds of media, rumors, and misinformation about COVID and the COVID vaccine circulating in our community. So today, I have invited Dr. Estelle and Dr. Parnell to give us real answers to real questions. These are questions that a lot of you have asked me, and so I wanted to bring in experts from our community to straighten things out for us. Dr. Estelle and Dr. Parnell treat our family members, friends, and neighbors, and have seen firsthand what COVID has done to people. They have also studied the science and are going to answer our top questions to dispel a number of rumors that you may have heard. Dr. Estelle and Dr. Parnell, welcome. Let me first start off by asking you, what are the ramifications for pregnant women in taking the vaccine? Because that has been a question that I've heard, particularly from a lot of younger women who are of childbearing age. Many of them that I have spoken to are reluctant to get the vaccine for fear that it may harm their unborn child.
You're correct. There is a lot of fear surrounding the COVID vaccine and pregnancy, and it's understandable. This is your unborn child. This is a very important task that women are charged with, is to ensure their health throughout the pregnancy. And so I understand the concern. The good news is the concern is completely unwarranted. The COVID vaccine is very, very safe in pregnancy. It is recommended in pregnancy. We have seen that those who are vaccinated, even if they get sick, they do not end up in the ICU. There's a decreased risk of preterm birth when you're vaccinated in pregnancy, an increased risk of stillbirth when you're vaccinated in pregnancy. We have seen that the babies actually get those healthy antibodies when they're born. So they've done studies to test and see if those antibodies pass over into the baby's circulation. And they have seen that that allows for babies to be born with some level of protection. Because as you know, babies and infants, they do not have a strong immune system when they're first born. Mm-hmm. And so any protection that we can pass along to babies are going to be advantageous in them surviving this pandemic as well. The other good news is that we've got long-term experience now. So initially, I too could have had some reservations in terms of the safety of this COVID vaccine in pregnancy. So if somebody would have asked me last summer, is the COVID vaccine going to be safe in pregnancy? I don't think I could have said with the same confidence that I can say today that it's going to be safe in pregnancy because of that fragile unborn child that we're talking about here. But seeing what we have seen and seeing how sick some of these ladies are getting in pregnancy, twice as likely to get admitted to the ICU. In terms of increased risk of death, I mean, there's just so many serious complications for an otherwise very healthy young mom that just happens to get COVID in pregnancy. And it doesn't fight fair. So we can't predict who is going to be the mom that gets sick and who's going to be the mom that is completely asymptomatic and happened to have a positive test before she went on vacation. So we just don't know. And I would hate for someone to not be able to ever meet what they have spent maybe a lifetime dreaming about because they were hesitant to get the vaccine. So I, without reservation, encourage every single one of my patients to get vaccinated. I always have a motto in our office is that we want to care for patients the way we want our own families cared for. And I would never recommend a vaccine to a patient that if I was in their same scenario that I would not receive myself, or if it was my cousin or my best friend, that I would not encourage her to get. So all that to say is the COVID vaccine is recommended, it is safe. There is no association with stillbirth. There's no association with the COVID vaccine and miscarriage. So it can be given at any point in the pregnancy. Prior to conception is even preferable if you know you're planning a pregnancy. But if you are pregnant and that opportunity arises to go ahead and get vaccinated during the pregnancy, at any trimester, it is safe to get that vaccine.
Wow. Now, there is a third dose of the vaccine. Is it recommended that pregnant women get all 3 doses, or are 2 doses enough?
At this point, the recommendation, if they fall into that category that is being approved for the booster dose at this point in time, so those who are high risk, let's say they're healthcare workers working in the school system, then they too, if they've reached 8 months past that second vaccine dose, then they are eligible for the booster, and it is recommended that they still get that booster in pregnancy.
Okay. And I kind of want to talk about what I think is an elephant in the living room, and it's particularly around the distrust that many people in our communities have with vaccines, with the medical profession. What are some ways that we can offset that we can help our people to become less fearful and less distrustful of medical professionals? What are you doing to help allay some of those fears?
I think the biggest thing is communication. So having these real conversations and being able to address people's concerns, because although it may not be my concern, if it's a concern or a hesitation that you have, then it's valid. And so I think being able to have the conversations and understand that we've thankfully and prayerfully come a long way from when some of those unethical, experiments were happening many decades ago, that we have come a long way in terms of research, in terms of representation. So having physicians that look like us matter, having individuals of color in research and trials matter. And so I think just impressing upon us that we are all a part of this process now. It is not just them, and there's a certain process that happens for the minority. This is a majority issue, and we have to fight all of these pandemics together. But I understand, and it is valid, and we just have to have conversations and talk about where we've been and how we are handling things differently, and the standard that is for one is going to be the standard for all.
Wow, that's good. That's reassuring to hear. Now, another question that I get from people in our community is they feel like it didn't take enough time to develop this vaccine. Some people are concerned that it happened too fast. What are your thoughts about that?
That's a really good question, an important one to discuss. And I think that people who are part of this process all the time, we know that it didn't happen overnight. And I think that folks who aren't involved in it day in and day out don't get the opportunity to see and recognize that we've actually been studying coronaviruses for decades. The first coronavirus epidemic or outbreak that really occurred was in the early 2000s, and scientists have been studying these viruses since that time. Around the globe have been working on it, and vaccines have been being worked on since that time as well. And the messenger RNA technique has been being worked on for at least a decade, and the viral vector technique has been worked on since the late 80s. So I think what's important to realize is that these vaccines and this process actually isn't quite as new as people think that it is. And then in addition to that, where we had this baseline of our scientific knowledge that had been gained and advances that we had at that time, and then when the pandemic occurred, the whole world of scientists started working on this singular event, this singular question. Everybody is normally answering all sorts of questions, and everybody's attentions are divided to what they've been researching, right? But everybody really focused on this one event, and part of that was able to occur because of funding. Focused funding was dedicated to this. And so that also helped move things along. And then after that, once we got to the clinical trials, typically with clinical trials, there's a set number of of participants that you need to have enrolled in order to be able to demonstrate safety. And that number, they calculate it, it gets set. Frequently, it actually takes a really long time to get that many people enrolled. It's typically around 20,000 or so, depending on what we're looking at. And frequently, that'll take a long time. But during COVID, everybody was so interested in helping to be part of the solution. People were knocking down doors to get into these clinical trials. And all three studies enrolled more than 30,000, sometimes 40,000 participants in no time. And then, so they did every step that is normal and natural for those clinical trials. And then after that, the approval process and the review process all went forward as usual, not skipping any steps, but they didn't have to wait in any of the typical bureaucratic lines. There's frequently a wait list of sorts, so to speak, for once they submit to the FDA. Before the FDA actually looks at that information, they dropped everything to do it right away. And then the other space where we save time is in the manufacturing. So typically manufacturing doesn't get started or even thought about until the vaccine has been fully approved. And they actually started working on those logistics before that occurred, which really helped save a lot of time as well.
Wow.
Yeah, just to piggyback on that, I had hesitancy too. I was concerned, are we going to let the politics affect the process of how this approval happens? And so doing kind of that same research and looking into it in terms of, no, they're held to the same standard. Those same, phases of trial still had to happen in the same, level of integrity, and the CDC did not compromise, and the FDA did not compromise their standard to get this out faster. But to all the things Dr. Estelle spoke of is how we were able to see that vaccine out faster. And that's what I had to come and appreciate too, because I was also, not being an infectious disease specialist, I had to, really understand, like, how are we going to get this out so quickly? And are we compromising the process? And at no point did we ever compromise the process. If anything, I think we're astounded by the efficacy of the vaccine to be hitting the shelves that quickly and just seeing how much of an impact it's had.
Well, as we get ready to close this conversation, I want to say thank you for answering all of our questions and debunking the rumors we have all heard. I hope those of you watching today will take this information and share it with friends and family. The vaccine is free and available at almost every drugstore, grocery store, pharmacy, or community clinic. If you cannot locate a vaccine, go online at dshs.texas.gov/COVID vaccine to find a location. We can and must protect ourselves. Please spread the word that getting vaccinated is the only way out of this pandemic. God bless you and be safe.